Dr. Sridhar Pattarazu, president and CEO of Vital Spring Technologies. He's both a businessman and a doctor.
To the doctor, not at all surprised, because he said this law was flawed from the start. And here's the scary thing about Sridhar Pattarazu. Everything he has said would happen with this has happened with this. So I want you to pay attention to this and to him.
Health insurance is not a proxy for getting health care. And if people are going to be forced to buy health insurance, which hardly covers what they're going to need to take care of themselves, then we're really pushing people over the cliff. You know, in the State of the Union, the president said last week that we've got to drive more competition, we've got to drive more innovation. But if we are forcing people to spend more money for something of more value, forcing companies to spend on coverage that doesn't inherently have value to provide for care, then we're actually doing more harm than we are good. And the president is going to be best served by responding now, as opposed to calling the bluff of the Supreme Court and waiting on the eve of the election, because that could be Russian roulette. If you look at the economics of how the subsidies come in from the government, there's something called these notches where, based upon the poverty level that you achieve, you're going to get certain levels of subsidies. But if you go above the threshold of 401%, all of a sudden by 2014, you're going to be left holding the pot, having to pay for coverage that you can't afford. So that enforcing the mandate puts more economic pressures on the average American that are unsustainable. And this isn't something that a judge in the Supreme Court, any politician here in Washington, can ever understand, because they know nothing about health care. You have people who don't understand the business of health care or the economics of health care making decisions about what's going to happen to the average American, and we have to put an end to the average American drinking that Kool-Aid. The mandate was to help insurance companies be able to pay for all of the people with pre-existing conditions they had to take on. If this is in limbo now, premiums are already going up, there's no means to hold these insurance companies accountable. I've been saying time and time again, we've really not addressed 80% of the market to help corporate America put the noose around the insurance companies, so they're going to still raise rates. Thousands of waivers have been issued to the law that sets the precedence for the fact that there really isn't a law then if you're starting to give exceptions to a number of different entities. So that the timing on the Supreme Court ruling, whether it comes out tomorrow or whether it comes out 9 months from now, is pretty much dead on arrival, because the verdict is already out. This law does not work. If we don't put the brakes on, according to Paul Ryan's plan, we're in big trouble. A year ago, because we forced this outrageous health care law through the door, we're now sitting here across the street waiting for government to shut down, because we've written a blank check for this new law with no idea of how to pay for it. And so the first step for cutting Medicare in terms of when the dollars are allocated and to make sure that we spend that money smarter for an entitlement is absolutely mandatory, because we've just figured out that we've been writing too many blank checks and we've now bankrupted the entire country. And we've got our backs against the wall right now in terms of really having no other choice. Obamacare has basically changed the entire way that insurance works. They can no longer factor in how sick an individual is. They have to accept anybody with pre-existing conditions. So what are they going to do? Of course they're going to raise premiums, because they have to stay in business. While nobody will disagree that looking at quality is ultimately important in the healthcare system, it's a pipe dream to believe that it's going to happen within the time frame that the Obama administration has put out there. And to the ad that you talked about earlier about using AARP, I'm not sure how many people recognize that the Obama plan today takes out about $700 billion to hospitals and to doctors. They needed to put the mandate in place, now the tax, so that insurance companies could take on all of these people with pre-existing conditions.
Right.
We wanted to control the insurance companies. We haven't done that. The insurance companies have gotten more control. They've gone out and bought providers' practices and hospitals all over the country. You reduce competition. You start to control the practices of what doctors can and can't do. So you've changed the entire dynamic of healthcare delivery.
So now
today.
doctors are answering to the insurance companies more than they did
we
before?
We haven't changed that. The government said that we were going to hold insurance companies more accountable. And in fact, with the ruling today, we've just given them one more card in terms of control. We've done nothing. No, I'm sorry, but self-insured employers today who insure most of the workforce have zero control in terms of controlling premiums for insurance companies. We've done nothing to empower them to keep in fact, premiums have gone up on average about $2,000 per family since the law went into effect.
And $1.1 billion will be refunded by August, thanks to the ACA from the medical loss ratio.
Because they didn't do what they were supposed to. The law said that they had to stay above the medical loss ratio threshold, and because they couldn't do that, every dollar that you spend, if you don't put 80 cents towards medical care, well, then you've got to pay a refund. So while it seems like it's money back in your pocket, guess what? What it means is the end result didn't happen. If you're somebody with diabetes and high blood pressure and a lot of medical problems, you need to be smart enough and know enough to know which plans you're going to pick. Otherwise, what happens? Costs go up. You end up not having the money, not having the benefits when you need them. And then if you can't get the benefits or the coverage, what happens? You end up back in the emergency room. So while this notion by Sears and Darden may seem innovative, there's a lot of companies that have defined or tried this defined contribution plan before, and it hasn't really been that successful. When you look at how the law was calculated, and that's why you need to put the brakes on, the unintended economic consequences of Obamacare are a disaster. What employers are doing to switch to part-time, what insurance companies are doing to raise premiums and game the system, what doctors are doing to reject Medicare, and what ACOs have now failed in the experiment, all of the assumptions on which the law was passed, saying that it's actually going to save money, are completely flawed. Suppose that I'm an employee of a company that has taken on what's called this affordable minimum coverage on the benefits, and God forbid something happens to me. I get in a car crash. The ambulance cost, if I need surgery, and any of the hospital costs would be on my dime. The employer wouldn't cover that. And the trickier part is that if my employer still provides that minimum coverage and I try to go to the exchanges, then I'm not entitled to get the government subsidy. So I end up paying more in the exchanges. The jury is slowly coming out in terms of how effective the Affordable Care Act really is, the nightmares that are happening between now and October 1st.
Yeah.
And ironically, they're starting to change the tactic because I believe that there's going to be a lot of political repercussion between now and next year. Small business owners and even big business owners are getting crushed. Every week we're finding out about a new loophole within Obamacare that is raising the cost for employers. 10 days ago, they found out they had to pay a fine of about $65 per employee in order to subsidize insurance companies. Today, we're finding out that in those states where Medicaid is not being expanded, they're going to pay more. So the costs for employers are going up, and there's going to be, if not already, a massive upheaval about their ability to absorb that. From a doctor's perspective, well, I think irrespective of what the employers are doing, you know, the doctors are continually getting crushed right now in terms of reduced reimbursements. Insurance companies are narrowing the networks and the number of doctors that they're going to include so that also many doctors are becoming employees of healthcare systems today, so that the entire shift in the way medicine is being practiced is changing overnight.
You know, I guess I should have listened to you at the outset, Doctor, because a lot of times when I thought you were crazy about these warnings down to waiting rooms that would get crowded and you'd be waiting longer. Nevertheless, I've wised up now. I'm starting to listen to you.